All right, welcome back to the Trauma Therapist Podcast. My name is Guy McPherson. My mission is to raise the awareness of trauma and to support and inspire new trauma therapists just starting out on the trauma-informed journey. I do that with my membership community, Trauma Therapist 2.0, my online courses and workshops, and the Trauma Therapist newsletter. If you're a therapist of any kind and you work with individuals who've been impacted by trauma, I invite you to head on over to my website at thetraumatherapistproject.com. That's thetraumatherapistproject.com. All right, let's get started. All right, you ready?
I am ready. Ask me anything. I'm open. So
okay.
Go for whatever you want to ask me. It's
all right.
totally fine.
Sounds good. Okay, here we go. So 5, 4, 3, 2, and 1. All right, folks, welcome back to the Trauma Therapist Podcast. Guy McPherson here, and very excited to have as my guest today, Dr. Frank Anderson. Frank, welcome.
Thank you. It's so great to be here. Thanks for having me.
You're welcome. So Dr. Anderson is both a psychiatrist and psychotherapist. He's completed his residency and was a clinical instructor in psychiatry at Harvard Medical School. Frank specializes in the treatment of trauma and dissociation and is passionate about teaching brain-based psychotherapy and integrating current neuroscience knowledge with the IFS model of therapy. Dr. Anderson is a lead trainer at the IFS Institute with Dr. Richard Schwartz, and maintains a long affiliation with and trains for Bessel Trauma Center. He also serves as an advisor to the International Association of Trauma Professionals. All right, Frank, welcome.
Thank you.
All right, excited to have you here. So let's dive into this. Look, you are in it, you're doing it. And I am curious about how you got here, what drew you into this field?
Yeah, it's a great question. And, interesting. I'm in the midst of writing a new writing project right now, which is totally getting me in the how did this all begin stage. So that's really interesting. I've been percolating that idea a lot lately. And honestly, I have a close family member, my sister, who had her first psychotic break when she was a freshman in high school. And, my dad is a pharmacist. He owned some pharmacies. I thought, of course, I'm going to be a pharmacist. It was just like this natural thing. And then what we all as a family went through and what I went through personally when my sister at a very young age had the psychotic break just shattered my world. It was like so profound and so powerful. I was like, oh my gosh, I have to save her. Like there was a part of me that was just like, I have to do something about this. Mm-hmm. I was in college at the time. So I was in the pre-pharmacy curriculum in college thinking I'm going to just march down that path to be a pharmacist like my father. But it was so devastating and earth-shattering. I love my sister so much. It was just like, I have to do something about that. So that really changed the trajectory of my life. It's like, okay, I'm going to go into pre-med. I was doing well, academically, and I'm going to become a psychiatrist because I need to save my sister. So
if I may, what was it about that that so shattered your world? There was a moment when we were sitting at you asked me that question and I can feel it all right now, honestly. Like there was a moment we were sitting at the kitchen table and, she's 6 years younger than me. So she's a sweet kid. And all of a sudden she's screaming because there's bugs crawling all over her face. This is what she was and she was in so much torture. She was in so much pain. And clearly there's nothing crawling all over her face, but she was having these hallucinations. And it was devastating. I mean, it just pulled at something in me that I had never felt before. It was just like, I can't take that pain. Okay. And interestingly enough, Guy, I'll tell you about that story. But that was probably tapped into a level of pain that I had thought I had never felt before. Okay. So it activated something very deep and powerful within me. I had on this trajectory to be a psychiatrist. And then honestly, lo and behold, I get into psychiatry residency programs where I met Bessel Kolk at the Trauma Center at Mass Mental Health Center, shoot myself into therapy because I'm working with all these clients chronically mentally ill, have no insurance. You have to be homeless with no insurance in order to get into the hospital that I'm working at, as you know, Mass Mental Health Center was such a mecca in the day. And so overwhelming again, it was just another round of holy cow, this pain is incredible. This pain is too much for me. So I got myself into therapy. And surprise, I have my own trauma history, you know. And then when I started identifying that, I was like, oh, okay, full circle. Like, I get this now, right? The pain of my sister activated something very deep within me. Then working with these kind of homeless, chronically mentally ill folks was so powerful and painful. And then it really was like, yep, this is why you're here. This is why you're here. And it really ultimately is because of my own trauma history. And, you know, it's been my life's work now, honestly, is to heal this pain that I witnessed, that I saw, and that I felt personally. But at the time, I didn't know that's what was being activated at all. It took me a while to get to, oh, yeah, this is me too.
Wow. Thank you for sharing that. I didn't want to interrupt you as you were telling that, but I wanted to get in there and find out about your sister. I was working with young individuals who were showing early signs of psychosis. So I'm somewhat familiar with that, but your telling of that is palpable. I mean, you can, as you said, you felt it and you can feel it. So you kind of shifted gears and you said to yourself, what, I want to work with people in this capacity in the mental health realm as a psychiatrist. How did things unfold for you?
Yeah, it's interesting that you say that. It's almost as if it was a choice, like as if I decided. It was more like, boom, I got compelled to do it. Like it was a force so much larger than me.
Wow.
So it was like I was drawn there, and I didn't know it was about my own history at the time when I made that decision, right? It was more about saving my sister. So I thank you for saying it was a choice, Guy, because it didn't feel like a choice. It was like compelled, like just it took me over. And, you know, I will say that that's been very consistent throughout my whole career, honestly, is I am so driven by it in a way that feels very powerful. And I'll tell you more about kind of the current trajectory, but, you know, got into therapy. Holy cow, I have a trauma history, working with these, you know, folks that were just in so much pain themselves, and just was lucky enough at that time, Bessel's Trauma Center was at my residency program. So I met him, knew him. He moved over to Mass General from my residency program. And I had that, oh my gosh, I have to work with trauma. I have to work with trauma. So I became the psychiatrist my 4th year of residency. I was chief resident, and then on the side worked for Bessel at the trauma center.
Wow.
So I became the psychiatrist for the trauma center and learned so much from Bessel. Like, you know, it was amazing to be in that environment very early on in my career, like 1992, as working with these people. We had an amazing team of people. And so I became a psychiatrist for the trauma center with Bessel van der Kolk, at the time was at Mass General. Then, and so I was working with really severely traumatized people. I was kind of used to that. 2004, I believe, is when it was that Bessel had always invited me to do a psychopharm conference at his annual trauma conference. So I was always doing a psychopharm workshop. 2004, he invited Dick Schwartz to do a workshop. You know, Bessel's just brilliant at finding people and bringing them together. You know, I've been a part of that trauma conference for feels like forever, honestly. And when Dick presented, I was like, oh, I'll go to this. This sounds interesting. And I went to Dick's workshop, and as Dick and I laugh, I was kind of like one of, you know, the dogs that bob their head in the back of the cars. I just kept doing this. I was like, oh my God, oh my God, oh my God. And I went up to Dick Schwartz, you know, during a break to introduce myself. And he's like, you're the guy that kept nodding yes the whole workshop, you know. And it was one of those, for me, an aha moment around, holy cow, this is something different. IFS.
What about it? What about it?
Yeah, exactly. So I had been doing work with people with, at that time, we called them multiple personality disorder, not DID. So work with a lot of people with parts. I was familiar with that. But at the time, we were having parts get along together is what we were doing. Dick introduced this idea of permanently healing traumatic wounding. And I'm like, what? Like, get those parts out of the past and bring them into the present and release what they're carrying. That was a game changer for me. That was like, holy cow. And, you know, even at that time, I was involved in the first EMDR trauma study, EMDR versus Prozac with Bessel at the trauma center. So I was a psychiatrist giving everyone Prozac, actually, and EMDR showed to be more effective than Prozac was way back when, right? It was the first study that we did. But Dick had talked about something totally different for me, like talking about these parts as people, healing them, releasing them, getting them out of the past. It really was an Oprah aha moment for me. I'm like, holy cow, nobody's ever talked like that before. I am in, you know, and then I just dove in, you know, and now I'm a lead trainer and working for the Institute and speaking all over about it. But it was something different for me in that moment. Now, a lot of other therapies do versions of that too. So I'm not at all going to say IFS is the only way, but at that moment, it was so profound and complete for me that it was, again, compelled into diving in. You know, one time at Dick will, and I will talk about this at one of Bessel's trauma conferences, not that first year. Subsequently, him and I had a drink in the lounge after the conference. And I just like, Dick, I'm here to help you. He's like, what? I'm like, I'm devoting my life to this and I'm here to help you. He's like, well, good. I've been looking for somebody to help me. You know, he's like, this is a big job. I can't do this by myself. And I just, in that moment, was like, I'm doing this. I'm devoting my life to this. This is so profound. And of course, in my own IFS therapy since way back when, and it had a huge impact on my own personal life, you know, so I have that too. Not only helping people make these changes, but it's made a dramatic change in my own life.
So IFS, for those who don't know, internal family systems, was it that it made sense to you profoundly because what? Did it humanize these parts more? How did it make sense in such a profound way to you?
Yeah, I loved the idea of, Dick calls it a peopled model of the mind. Like, these are little people running around in our psyches, right? So it humanized them, which was one thing. The issue of every part has a positive intention was huge for me. Like, even the cutting, suicidal, drinking, heroin shooting parts, positive intention. I loved that. That made sense to me. It was a beautiful, non-pathologizing approach to the human psyche, because everything else is pathological. As a doctor, you cut it out and you get rid of it, or you give a pill to take it away, right? That's the medical model, right? And so this was so different than a medical model, so much more humanizing, if you will. And I had a layer of protection. My parts were so protective of my underlying wounds. The other piece was accessing my vulnerability. It was like Fort Knox in there. Like, there was no way in, you know. My therapy that I was in, honestly, Guy, I was 5-day-a-week analytic therapy for 10 years. Okay, all through this journey. I'm like, I was a committed, devoted, by choice, believe it or not, by choice. I had a lovely analyst therapist. He was such a human being. He was a lovely person. Love him dearly to this day. But nothing got at my trauma. That did not get at my trauma history at all. You know, it was I loved working with him as a person, but the analytic work didn't do it. So I had super great ego and never got to the vulnerability. So the IFS piece accessed my pain and wounding in a way that was so powerful. And then releasing it on top of that, not only accessing it, but being able to release it, it's been amazing for me.
Wow.
Really amazing.
You mentioned the medical model. I mean, that's your pedigree. You walked into that. You went to this amazing school, amazing residency.
Yes.
Also with Bessel van der Kolk. he's done that too. But and there's a really incredible irreverence he has for the medical model. What was that like for you? Did you question yourself? Wait a minute, this doesn't fit with what I'm supposed to. Talk to us about that.
Yeah, it didn't fit with who I am. It didn't fit with, I went into the medical model because I was really fascinated with the human body. Like I had that fascination. So I thought science was really cool. I was a chemistry major, so I had that kind of mind to be able to get into that field. And I was good at it. But it was very, like in those days, you did a whole year of medical internship before you entered your residency. So I was doing medicine. It was very formulaic for me. You know, here's the bacteria, here's the antibiotics, here's the protocol. So for me, there wasn't a ton of creativity, even though I understand there's an art to medicine. I wasn't feeling that. I remember a moment during my internship where they had me go onto the psych unit, right? So I had cover the psych unit while I was on call for the weekend. And they're like, come and sit in community meeting. I'm like, okay. So here I am as this intern sitting in the community meeting, and I've got like 35,000 things to do before I get off my 36-hour shift of call, right? And these people sat in chairs together, staff and clients alike, and they talked about their day. And I was like, are you kidding me? Like, really? Like, you can sit and talk to people? You know what I mean? Instead of stand outside their room in your white coat and then talk about them while you go to their bedside. You know, it just was like this, like, this is what I want. Like, I'm so relational as a person. And it was just like, oh, you could talk to people, you could have relationships with them. So I would say Dan Siegel, Bessel, me, like, you know, there's a bunch of us that were our doctors who, you know, my people are therapists more than they are physicians, honestly, because it just resonates with me more. It's who I am. I'm so relational. So I don't feel aligned with my MD-ness. Like nobody calls me Dr. Anderson, like good Lord, I'm Frank, you know what I mean? So I value the science. I love the science. I love the way my mind works and the way we're learning and evolving. So I'm certainly interested in staying up to date on that stuff. It's fascinating to me. And I'm much more of a therapist than I am a psychiatrist giving medicines, for example.
Let me just remind everyone that I'm speaking with Dr. Frank Anderson. So, all right. So incredible. I love the way you're sharing your story here. Your most recent book, Transcending Trauma, Healing Complex PTSD with Internal Family Systems. I want to talk about that, but so you where did we leave off here? You found Dick Schwartz. What did you do next?
Yes. So once I found Dick Schwartz, I dove in the way that I do, took level 1, level 2, level 3. I PA'd or assisted 5, 6, 7, 8, 9 times. Like, you know, I dove in this very intense way because it was so compelling, my own healing, right? Got into IFS therapy. Dick at some point had asked me to run a non-for-profit foundation for IFS. So I ran the IFS Foundation for a while, a nonprofit that expanded research in IFS. So I, you know, quickly rose to the top, if you will. I became a lead trainer. I started teaching a 5-day intensive training on IFS trauma and neuroscience, running this IFS Foundation. So I just really like rose to the top in the way that I kind of typically do, and have been doing that, teaching. And I interestingly enough, more than a psychiatrist, and even probably more than a therapist, now I'm a teacher. I'm really good at assimilating complex information and being able to teach it in a very simple, easy, user-friendly way. So I'm teaching all over the place, teaching IFS. And at some point, you know, I had written the first book co-authored on a skill, like a how-to IFS. It's called the IFS Skills Training Manual. It was a basic how-to, right? And then you get to a point in your career, it's like, it's time for me to put all this knowledge somewhere, you know? And for me, that's what transcending trauma is. It is really like, okay, it's kind of my body keeps the score, if you will. Bessel's poured his whole life's work into that book. And for me, transcending trauma was that. It's that I want people to know, here's my work. This is the unique way I've applied IFS to the treatment of trauma, because I've been a trauma therapist my whole life. So I've expanded the IFS model as it relates to trauma. I'm incorporating neuroscience. Everybody's super jazzed about learning the brain stuff. And really important was to speak about my trauma history. Like, that was another kind of foundational piece for me, is that I don't like this us and them divide. I'm the expert, you're the patient, you're the client. So like in the first, the first paragraph of the damn book, I say, I have a trauma history. Do you know what I mean? It's like, that was very important to me to say to people, I may be an expert, I can teach you about the science, let me teach you about IFS, and I have a trauma history. And that was very important to me in my, I will say, platform or brand. And, this book recently just came out May 19th, and it's had such an impact on people in a way that's just so beautiful for me. I get so much feedback. Thank you. Like, there's nothing better than being able to touch somebody with your thoughts and ideas. Like, that has just been the most beautiful thing for me. Like, I hoped for that, but I didn't really expect that, right? And I'll say this last piece here around this, because once that book, I remember going for a run and like, okay, world, here it is. Like, it's yours. Like, I released it, right? And ever since then, I am now very compelled, in the same way that I've been compelled my whole life, to bring this idea of healing to the general public. Like, that is the next place for me. I'm very clear. I'm already doing that. Is like, I want people to know that trauma blocks who we are, and that healing our trauma makes us more and more our authentic, aligned self. Like, my favorite quote of this book, Transcending Trauma, is, trauma blocks love and love heals trauma. And I think it's a cycle, and I experience it personally. And I want people to get that message that healing is possible. Trauma blocks who you are. It blocks your love. It blocks your ability for connection. And healing it, oh, by the way, I'm doing that, and love is what heals, self-energy in IFS terms. Love is the very thing that heals trauma. And I want everybody to get that message. I want people to know it's possible, see that I've done it, want them to be inspired to do it. I want to create a web of people to help heal this world, because we need it. We need healing badly right now. And I want to be a part of that.
That is amazing. You have an incredible way, and an amazing way of articulating what you're doing and how you're doing it, and your authenticity. And I love it. Who's the book for?
Yeah, so this book is for clients and clinicians, honestly. This is a more, I think they call it, I don't even, a trade book or whatever it is. This is a book for people who are clients who are struggling with trauma histories, and it's for therapists primarily. It's this, an expanded how-to as it relates to trauma. So it's more an industry, it's more a psychotherapy, psychiatry industry book, and interesting, I have a call tomorrow with a publisher around the next book already, which I mentioned in the beginning, and it's a memoir. It is the book for the general public. So my next project is a book for the general public about my story in much more intricate detail, but the same message. Trauma blocks love, love heals trauma. So that is my next project. I am so excited about it. And this is getting that message to the general public, right? So this book is for therapists and psychiatrists and clients. A lot of clients have said it's been valuable for them. So that's the next step in the journey, is to bring it to the world in that way.
What do you feel that therapists need to know, could benefit from knowing? Obviously a lot of therapists are going to be listening to this, a lot of survivors, a lot of therapists who have experienced trauma. But in terms of being a therapist and working with people who've been impacted by trauma, what do you feel maybe they're not getting enough out there?
Yeah, it's a great question, and it's really important for me. That's why I really see myself as a teacher in large ways, because trauma treatment is specialized. It is not, you cannot, in my view, get general training as a therapist and be able to treat trauma survivors. It's unique, it's individual. There are so many ways, because of the violation that gets created with our self, because of trauma, that requires specialized treatment. I really believe that. And I've done so many consultations over the years where well-intended, beautiful, open-hearted therapists go terribly down the wrong path because of giving too much and offering too much, because of being too strict and rigid, because their own parts get too activated. The wounded healer issue, like, oh, hello, nobody goes into this field for altruistic purposes only. Sorry, I'm calling myself out and I'm calling everybody else out. Like, we go in this because of our own wounding to some degree, And so if you don't do your own work, and if you don't have some kind of specialized treatment, and it doesn't only have to be IFS. I don't have to hold it, this is the one. I just did a course, called the integrated therapist, looked at EMDR, sensory motor psychotherapy, AEDP, DBT, CPT, cognitive processing therapy. Like, there's a lot of ways to specialize in the treatment of trauma, because there are unique circumstances that really can, if done the wrong way, can really re-traumatize people, can open them up in a way that is not safe, and can be harmful. So that's important for me. And that's, as I'm talking about moving into the general public, I'm very mindful of that. Like, you just can't do this stuff willy-nilly or just randomly. Like, go get that specialized treatment. There's a lot of specialized ways to treat this, and it can be done. And I want to be one of the people that teaches how it's done, because I think, again, well-intended therapists just walk into these minefields and get into so much trouble. And then they get demonized, because they've done harmful things, but that's not the intention at all. So I'd say get that extra specialized treatment, and one that resonates with you, right? One that feels right. Like, for me, IFS is like, it's the most complete model, and it works well with me, for me. Whatever works for you, Janina Fisher, sensory motor, Debbie Korn with EMDR, like, okay, there are a lot of other options out there. SE, somatic experiencing. So find what works, get that extra training, because it does require something special. We're talking about relational violations. And if somebody comes into a treatment with a stranger and develops an intimate relationship, excuse me, that's a setup. That is a setup for reenactment. So you have to be prepared to know how to manage those inevitable things that are going to show up, because that's what people bring. And if you don't know yourself well, you haven't done your own work, you're going to get tripped up. That's my view.
Speaking of that, can you share an early clinical error and what you learned from that?
Oh, which one? How many do you want?
Just the one.
Okay. Guy, you know what? I want to do a mistakes conference. I think that, like, we talk about all the ways we do it correctly. Like, let's do a mistakes conference, right? I think that would be awesome, because, oh my goodness, the only reason I am better at this now is because of all the mistakes that I made. I will say that. And, I'm going to say two things. One is I'm aware of being activated and oversharing at times. Okay, so that is something I certainly have known to do, is that when I'm really stirred up and I'm really activated, and this is because of my own parts, I could overshare. And I've had a couple examples where I'm thinking this is what so-and-so is needing or wanting in this moment, and it ends up being intrusive to them and kind of more about me than about them. And you can see it on their faces, you know, when you share something that is what they're needing, and when you're sharing something that is more about you than about them. Mm-hmm. You know what I mean? So that's one thing I'm aware of. I haven't been one of these, I'm such an open book in some ways, as you can maybe tell. I haven't been the rigid, no, like nobody's home kind of person. But another example is when a client really got triggered in trauma and really, saying this in quotes, traumatized me, attacked me in a way that was aggressive, it was violent, and it triggered me so much that I did not have the capacity to hold the space. Okay. And I set up a barrier of protection. It's not okay to talk to somebody like that. You know, you've got to use your words, you know, attacking somebody verbally is not okay. You know, it was this kind of thing. So I set up that boundary. And in some ways, me setting that boundary was very healing for my own trauma history. Like, it was good for me to say no, right? But what it did was it blocked access for my clients' wounded, young attachment wound to myself, my soul, right? The boundary blocked access to me, right? My heart, right? And you know, 6 months later, several consultations later, the therapy dissolved, you know, and in retrospect, I could say the therapy dissolved because my trauma got activated. My client couldn't recover from it because I apologized 20, 30, 40 times, and it didn't matter. You know, this was a very wounded person with a very severe history, and they needed that attachment to me. And when it got severed during those moments of time, it was kind of their inability to recover from that severing. Right. You know, they didn't have the capacity to recover. The block to my heart was blocked. And, you know, God, I remember that. That was so powerful. If you are okay, I can share one more.
Sure.
Is that all right? Because This is another thing that just popped into my head that was very powerful around mistakes too, is working with people with very young, early pre-verbal attachment trauma and validating and supporting them to a fault. That there was a lot of distorted thinking that I wasn't setting a boundary around. I was just supporting to a fault. Of course you feel this way. Of course that makes sense. Of course. And I never brought in reality. And I had this happen twice with 2 clients. And those thoughts turned into psychotic thinking. And they developed psychotic transferences to me because I didn't introduce reality enough. I was too supportive in a way, and like, how the heck could you be too supportive, right? But it was not to the client's self, to this young attachment part who had very immature, premature, distorted thinking. And those parts kind of developed psychotic transferences to me over time. So that was something in retrospect. It's okay to be supportive and it's necessary, and reality is also important too. Right. So that was a valuable lesson for me around that I feel bad about these folks to really, their young parts really got psychotic around me in a way that was very hard to undo. Once those psychotic thoughts get embedded, it's hard to undo that. So thank you for giving me the space. Those are three places of mistake that I want to teach people about.
Right. Yeah. Thank you for sharing that. Boy, Frank, there's so much to talk about. I mean, I could just talk to you on and on. I'm going to have you back at some point.
Yes,
Definitely when that
absolutely.
new book's come out. But look, okay, the book is Transcending Trauma, Healing Complex PTSD with Internal Family Systems Therapy. It's out. Where can people get it?
Yes, so people can get it on Amazon. People can get it through the publisher, which is Pesi.com, PESI.com. Okay. It's on Audible, all of the Audible. The audiobook is out now too, audible.com and Apple and Spotify. So, yeah.
Awesome. Okay. What's the best way for people to get in contact with you?
Yeah, absolutely. So getting a brand new website that's going to be released any day now. However, my old website is still up, and that is totally the best way to reach me. It's frankandersonmd.com.
Okay.
And there's an email list you can sign up and find out what I'm doing and, follow me in all those kind of ways. And also Instagram and Facebook. I've become this okay, Instagram's a thing now. So I've got this whole thing going on. I think it's Frank_AndersonMD is my Instagram account. A lot of people follow me there now. It seems to be the new way. So yeah, those are ways to reach me.
Okay. I want to ask you about a go-to book recommendation, whether trauma related or not your book. Any other thing that's you've been reading lately or that's inspired you or you'd like to put out there for people?
Yeah, I'm in the midst of reading it. I think it's called Cured. Let me see if it's down by my bedside right now. And boy, there's so much. I could talk about spirituality. There's so many spiritually related books that I love that have really kind of hit me in a big way. So I love spirituality, but Cured is this book by a guy from McLean's, and he talks about miracle cures. He's a psychiatrist from McLean, and he talks about these pancreatic cancer cures and, these unbelievable unknown cures that really does bring in the spiritual belief. It brings in healing through nutrition and exercise. It's a fascinating book. I'm in the middle of it right now.
Is that Jeffrey Rediger?
Yes, Jeffrey Rediger. Thank you very much. Yeah. Bringing in totally outside of the medical model. Hey, maybe we need to look at this stuff because he goes very spiritual. He goes very nutritional. And he's there are these spontaneous cures that happen here and medicine cannot explain it and describe it at all. Wow. So I love that. And I'm excited about that. And I have not finished it, but I'm intrigued by, there's so much more beyond what we think we know and how to heal this stuff. So that's one I would recommend.
Awesome.
For sure.
Awesome. Frank, so glad I got to meet you, and I'm so glad you came on this podcast because you are amazing. I've got to say it. Thank you so much.
Thank you so much for having me. I really appreciate it. Thank you.
All right. Take care.
It's been great. Bye-bye.
Awesome. Thank you so much for listening and supporting this podcast. And if you'd like to join the hundreds of other therapists who are each month keeping up to date and informed and inspired about what's going on in the world of trauma, I'd love to invite you to head on over to the Trauma Therapist newsletter. That's the traumatherapistnewsletter.com.